You're walking along a pond. The water is still. You see what looks like a rock with a tail. You get closer. Maybe you're curious. Maybe you want to help it cross the road. Then, in a flash, a neck longer than you expected shoots out, and those jaws clamp down on your finger. What happens next? Most people think a snapping turtle bite is like a dog bite or a snake bite. It's not. It's something else entirely. And if you don't know what to do in the first 30 seconds, you can make everything 10 times worse. Today, we're answering the question you hope you never need. What if a snapping turtle bites you? Let's get into it. First, you need to know who you're dealing with. There are two main types of snapping turtles in North America. The common snapping turtle, Chelydra serpentina. These guys are everywhere. Ponds, lakes, marshes, even drainage ditches. They typically weigh 10 to 35 pounds, but some old-timers can hit 50. Their shells are rough, almost dinosaur-like, and their tails have those iconic sawtooth ridges. Then there's the alligator snapping turtle, Macrochelys teminki. This is the heavy hitter. Found mostly in the southeastern United States, rivers and bayous in Texas, Louisiana, Florida, Georgia. These things can weigh over 200 pounds. They have a worm-shaped lure on their tongue to catch fish. They look like a prehistoric tank. Here's what you need to remember. Both species can bite, but the alligator snapper has a much stronger bite force. We'll get to the numbers in a minute. The good news? Neither one wants to bite you. Snapping turtles are not aggressive in the water. They'll swim away. The trouble starts when they're on land, especially during nesting season in late spring and early summer. A female on land feels vulnerable. She can't retreat into water, so she defends herself, and that defense is fast. So what actually happens when one bites? First, the neck. A common snapper's neck can extend half the length of its shell. That's about 6 to 10 inches in a split second. The alligator snapper's neck is shorter, but its head is massive. The bite force of a common snapping turtle has been measured around 200 to 250 newtons. That's roughly equivalent to a medium-sized dog bite, enough to crush a finger bone. But here's where it gets scary. The alligator snapping turtle has been measured at over 1,000 newtons. That's comparable to a large wild carnivore. There are documented cases of alligator snappers biting through broom handles and even damaging steel rake tines. But here's the nuance. The snap is fast, but the hold is where the damage happens. Turtles don't have teeth like a dog. They have sharp, bony ridges called beak-like jaws. When they clamp down, they don't tear flesh. They crush and shear. Think of it like a pair of wire cutters made of keratin. People who have been bitten describe it as a sudden, intense crushing pressure, followed by a burning sensation as the beak digs in. One survivor on Reddit described it as slamming your finger in a car door made of serrated plastic. The worst part? Many turtles won't let go. They lock their jaws, and you have to figure out how to release them without losing the finger. Okay, you've been bitten. Adrenaline is pumping. Your first instinct might be to pull away as hard as you can. Do not do that. Mistake number one, pulling straight back. When you pull, the turtle clamps down harder. Those jaw muscles are designed to resist escape. Pulling also tears the skin along the beak's edge, turning a crush injury into a laceration. You'll lose more tissue, and healing becomes much harder. Mistake number two, shaking or swinging the turtle. This is even worse. The turtle's neck is strong, but shaking can cause the beak to twist inside the wound, breaking bone fragments and severing tendons. Plus, now you have a panicked, swinging reptile that might bite someone else or get thrown into traffic. Mistake number three, cutting off the turtle's head. I have to mention this because people have tried it. First, that's cruel. Second, a turtle's jaws can still clamp after death. The bite reflex continues. Third, you've now spilled blood and guts into an open wound, guaranteeing a massive infection. Do not do this. So what actually works? There are 3 proven methods. They sound strange, but they work. Method 1. Submerge it in water. Snapping turtles breathe air, but they feel safer in water. If you're near a pond or stream, and you can reach it without dragging the turtle, Gently lower both your hand and the turtle into the water. In many cases, the turtle will release within 30 seconds because it wants to swim away. This is the gentlest method for both of you. Method 2, use a pry tool. You need something thin and flat, but not sharp. A butter knife, a credit card, even a sturdy leaf. Slide it between the turtle's jaws from the side, not straight in where the beak is strongest. Twist slightly to lever the jaws open. The turtle may resist, but the pry will interrupt its bite force. Method 3, the alcohol trick. This sounds like a myth, but it's been reported by wildlife rehabilitators. A drop or two of isopropyl alcohol or even vinegar on the turtle's snout, right near the nostrils, can cause a reflexive release. Don't pour a bottle, just a small amount. The irritation overrides the bite reflex. This works best for common snappers. If none of these work, you wait. Seriously, turtles can hold on for a long time, up to 20 minutes, but they do tire. Stay calm, keep the limb as still as possible, and call for help. A second person can drive you and the turtle to a wildlife center where they have proper tools. The turtle lets go. Now what? First, do not panic clean the wound with alcohol or hydrogen peroxide. Those damage the tissue your body needs to heal. Instead, rinse gently with clean water or saline. Then cover with a sterile gauze pad or clean cloth. Apply pressure if there's arterial bleeding, but most snapper bites bleed more from crushing than from severed vessels. Second, get to an emergency room or urgent care within a few hours. Here's why. Snapping turtles carry bacteria in their mouths, including Aeromonas, Pseudomonas, and Salmonella. These can cause severe infections, especially in bone or joint spaces. You will almost certainly need antibiotics. In some cases, doctors will do an X-ray to check for fractures or crush damage to the finger bones. Third, they will ask about tetanus. If you haven't had a tetanus shot in 5 years, you'll get a booster. That's standard. Fourth, reconstructive surgery is rare but possible. If the beak cracked a bone or severed a tendon, a hand surgeon may need to repair it. Most bites heal with splinting and antibiotics, but deep bites can leave permanent numbness or reduced range of motion in the finger. One more thing, don't worry about venom. Snapping turtles are not venomous. No species of turtle has venom. The danger is purely mechanical and bacterial. You heard the old wives' tale. A snapping turtle can bite off your finger. Is it true? For common snapping turtles, mostly no. There is no verified case of a common snapper completely amputating an adult human finger. They can crush it, break it, tear skin, and cause permanent damage, but the beak is not designed to cleanly sever bone. Think of it like a pair of bolt cutters versus scissors. Bolt cutters crush, scissors cut. The snapper crushes. For large alligator snapping turtles, yes, it's possible in theory. A 150-pound alligator snapper has been measured with a bite force of over 1,000 newtons. That is enough to snap a small broom handle. Could it sever a finger? Possibly, especially if the finger is small, like a child's pinky. But for an adult finger, amputation is still extremely unlikely. The beak shape works against clean severance. You'd more likely get a crushed, mangled finger that requires surgical amputation later due to necrosis. So the answer? Don't test it, but also don't live in fear. Most bites happen because people tried to pick up or harass the turtle. Leave them alone, and they leave you alone. The best way to survive a snapping turtle bite is to avoid it entirely. Here's the simple protocol. If you see a snapping turtle on land, give it space, at least 10 feet. Do not block its path to water. Do not poke it with a stick. Do not try to flip it over. That can damage its internal organs. If you absolutely must move it, for example, crossing a busy road, never pick it up by the tail. That can dislocate its spine. Instead, use a flat shovel or a car floor mat. Slide it under the turtle from behind, then drag, Don't lift the turtle to the other side, or grab the back of its shell just above the hind legs, the safe zone where the neck can't reach. Lift straight up, keep it low to the ground, and carry it like a bucket. If you're in the water and see one, swim away slowly. In water, they will not chase you. They'll dive and disappear. That's it. Respect the animal. Don't test its patience. And you'll never need to use any of the first aid advice from this video. So let's recap what you learned today. A snapping turtle bite is fast, crushing, and painful. Common snappers bite hard enough to break small bones. Alligator snappers can bite through a broom handle. If bitten, don't pull, don't shake, don't cut off its head. Try submerging in water, using a pry tool or a drop of alcohol on the snout. After release, rinse gently, apply sterile gauze, go to the ER for antibiotics and a tetanus shot. And best of all, avoid the bite entirely by leaving snapping turtles alone on land and giving them space in the water. If you found this useful, hit that like button. It helps more people learn what to do before they get bitten. Subscribe for more animal facts, survival guides, and what-if deep dives. And drop a comment. Have you ever seen a snapping turtle in the wild? Let me know. Thanks for watching and stay safe out there.